Well, hello again. It's Jason with the Alternative Mobile Services Association. Today I'm with Julie Wertheimer of the Pew Foundation. Julie, thanks for coming to talk to us.
Thanks for having me.
Could you start by telling us a little bit about yourself and how you got involved in this kind of work?
Absolutely. So I've been with the Pew Charitable Trust for about 5 years, and currently am leading our mental health and justice partnerships project, which is largely focused on um, how to better improve behavioral health emergency response. Specifically, right now, focused at the state level and what state policies, practices, legislation can be put in place to facilitate better responses from the point of someone making a call, either because they are in crisis themselves or because someone near them is in crisis. However, prior to that at Pew, I worked on our sentencing and corrections project, which was a larger look at the criminal legal system, looking at prisons, jails, community supervision, both adult and juvenile. And then prior to that, I spent the bulk of my career working in city government in Philadelphia, where when I left, I was the founding senior director of criminal justice, working for the mayor and working with all the various criminal justice agencies across the city and county. Philadelphia is both a city and a county. I really developed an interest in this area in general in public service because of a strong tradition in my family. My mother was very involved in politics and township government. My father was involved, was a physician, so involved in the medical system. And so the idea of being able to really get in there on the inside and try to improve systems for better outcomes for individuals appealed to me at my core. I also have a long history as the grandchild of Holocaust survivors. I unfortunately have the knowledge of how the state can be used for bad against people, and being able to be on the inside and try to prevent that from happening, whether we're talking about policing in communities of color or other issues. Really took lessons from my own personal family history that informed my career and my passions. I also say the specific focus now on individuals with mental illness, substance use, other behavioral health issues comes from, again, my own personal experience with family members with mental illnesses and how they've been treated versus how I've seen others be treated, and also having a disability myself and understanding what criminalization of disability means.
Well, thanks for telling me that, Julie. That's so important to know who you are and that you have some skin in the game yourself, not just you, but your family going back quite a
Absolutely.
ways. That brings real authority and credibility to what you have to say.
Yeah.
So I wanted to talk to you about an article that you posted in the Pew website, and it's quite stunning to think about if you get a chance to read it. And we'll put the link below this video in the newsletter so that people can go directly and read this article themselves. But would you talk about a little bit about your approach to writing this and how you got the the idea to do it?
Sure. So the brief is called More Than 1 in 9 Adults with Co-occurring Mental Illness and Substance Use Disorders Are Arrested Annually, which also gives away the primary finding of the brief itself. But we thought it was important to pursue this topic because we obviously work in the area of individuals with mental illness. We've seen both the rise in popularity of mental health courts and drug courts, but there is a fairly significant and substantial population that have both mental health challenges and substance use disorders, sometimes related to each other, which are known as co occurring disorders, that are often overlooked. An individual is usually treated for either their mental health issue or their substance use issue, but not addressing both at the same time, which can lead to less effective treatment, less resolution of issues, and more likely to end up back in the justice system. And so, as part of our work, we analyzed data from the National Survey on Drug Use and Health, looking at data from 2017 to 2019, pre-COVID, to better understand how people with mental illness and or substance use disorders interact with the justice system and what kind of outcomes they face. NASDA, great acronym in my opinion, is an annual nationally representative self-reported survey, and the only national data source for trends in the incidence and the treatment of behavioral health, which includes both mental illness and substance use disorders. The survey also asked respondents whether they were arrested in the past year, and if so, how often. So we recognize that while this is the best data that exists, it's limited, and I want to put that out there. The survey does exclude people who are currently incarcerated in prison, who are in nursing homes, active military personnel, and the individual must have a fixed address. So understanding there's a lot of people with mental health and or co-occurring disorders who struggle with employment, maintaining stable housing. The numbers from the survey are likely an undercount of this population.
And isn't it the case that this particular survey has been revamped just in the last few years to address some of those concerns?
It is my understanding that it has been, but also I think an emphasis has been put on trying to keep it as consistent as possible because while having the limitations we just discussed, it is the only nationally representative baseline that exists, and it's important to keep that through line.
Now, I would guess, though, that the vast majority of people with severe and persistent mental illness have never been arrested, and they never will be arrested. So this really throws your number into a smaller category of person.
But I still think that it's the findings among adults with the mental illness were still really significant, though, and that's really important to recognize.
In that there's a smaller number of people who are arrested over and over and over again.
Right. And when you look at, the fact that we're talking about someone with a mental illness who's twice as likely to get arrested as an individual who does not have a mental illness, but then people with co-occurring mental illness and substance use disorders were 12 times as likely to be arrested. That is a huge, huge jump in the likelihood of individuals with these various behavioral health challenges.
What a burden! What an amazing. Now, does this make you ponder the mechanics of the criminal justice system?
It certainly highlights that there is opportunity for improvement in the care for individuals, especially with co-occurring mental illness and substance use disorder. And the fact that the data show that adults with co-occurring disorders are over-arrested and under-treated certainly points to the need for new evidence-based solutions that can reduce contact with police and the justice system and improve outcomes for those people with complex behavioral health issues.
Now, I have stood in the salad board of several jails and asked the same question: How many people coming in and out of here are people with mental illness and addiction? And the sheriff's deputies always give the same answer. It's like 110%. How do you think this survey is accurate? It's self-reported, but do you think the number could be larger?
As I said, we recognize there are limitations to this survey, especially with the requirements that existed at the time of the data that we looked at, that, disqualified individuals who didn't have fixed addresses, which could be a large number of people. So it's definitely possible that it is an undercount. That being said, even if it isn't, it's still a significant share of the population, and that cycling through our jails and the rest of the criminal legal system that certainly needs more solutions available.
Were there particular demographics in the survey that uh, popped out to you that were particularly significant?
Yes, Black and Hispanic adults with co-occurring disorders were less likely to receive mental health or substance use treatment as compared to white adults. For Black individuals, for only 47%, for Hispanic individuals, only 43%, uh, whereas white individuals was 64% received treatment. So it's a
So,
significant disparity.
so do you think that treatment as it exists is an effective mitigator here? That if we had treatment available for more people in more sectors, we might reduce this or over arresting?
Well, I think it also depends on what kind of treatment, because
Mm-hmm.
I keep emphasizing co-occurring disorders here for a reason,
Mm-hmm.
because we've often seen the siloing of mental health concerns, mental illness versus substance use disorders. They're even divided in many governments at many levels,
Yeah.
whether federal, state, or local. But this is a population that needs both addressed at the same time. And so I think it's important to talk about increasing the availability of treatment, but also increasing the availability of treatment that addresses co-occurring disorders.
And does your thoughts or survey have any consideration of ancillary services, adjacent services like housing, like alcohol and drug-free housing?
This survey and our analysis of it didn't specifically touch on that.
Mm-hmm.
However, as I even recognized when discussing the limitations of the data, we know that the need for stable, supportive housing is often a challenge for individuals dealing with behavioral health concerns, whether we're talking about, residential treatment facilities or recovery housing or just housing in general, as well as employment being an important stabilizer for these individuals.
Now, our our membership is, of course, keenly interested in mobile crisis.
Mm-hmm.
Can you connect how mobile crisis work could make use of this information?
Yes, I think it's important to understand that, first of all, mobile crisis is often seen in the field as an alternative to police only response to individuals in crisis, and removing the interaction with police, I think, can decrease significantly the chance of arrest for obvious reasons. But I also would encourage those who provide mobile crisis services, again, cannot emphasize enough the need for treatment that addresses both mental illness and substance use disorder. Hard to deliver on the spot either of those, let alone both together. But when thinking about referrals, warm handoffs, what kind of treatment and support are we bringing this individual to? It's important to dig deeper, and one might be presenting at the time, a substance use disorder might be presenting at the time, but there might be an underlying mental illness that also would benefit from treatment.
Right, we're an alternative to police, not an alternative to treatment.
Right.
And sometimes that coming forward of the sort of primary medical disorder takes a long time. It takes a person coming in and out quite a bit, and maybe being in and out of crisis quite a bit. Any thoughts on sort of long term care for folks in this context?
I think it's really important that when we talk about the kind of supports from the response through the rest of the continuum of care, that we keep the emphasis on health first and understand that individuals who are suffering from these behavioral health challenges um, may not be able to be responsive to the treatment or services provided to them the first time. It may take several bites at the apple. And uh, the most effective way to stabilize the individual is to keep treating them, even if it doesn't work the first time. And we need services and a broader continuum of care that is able to provide that long-term support and connectivity. So you don't have individuals bouncing from program to program, starting over again, but rather have some stability and continuity.
How do you think that court administrators and judges and public defenders, prosecutors might make use of this information, sort of seeing their the person in front of them in a different light?
Well, I hope that it emphasizes that these are health challenges first and foremost. And it's important to recognize the behavior that is driving whatever activity got that individual into the criminal legal system in the first place. So I hope it promotes more of an understanding of not only um, the overrepresentation and the need for the system to take a look at why there's overrepresentation of individuals with behavioral health issues in the criminal justice system, but also the complexity of these issues, that it's not straightforward. This person has A, this person has B. It can be a lot of different issues wrapped up together. And still, the need for treatment should be at the forefront.
Well, thank you, Julie. Thank you, Julie Wertheimer, for coming to talk to us at AMSA Talks. What a great article you've written, important for us to know and understand. And thanks for helping us do that.
Uh, Thank you for having me. And I encourage everyone to follow both myself and the Pew Charitable Trust on LinkedIn. You can read more of our articles on the website if you follow the link that Jason sent. And I'm glad to be here.
Take care.